I'm Beverly Kirk, director of the CSIS Ideas Lab, here today with Ben Self. He is a CSIS adjunct fellow in the Japan chair, and he has written part of a new report on the changing landscape of global health diplomacy. Thanks for being here.
Pleasure.
You focus specifically on Japan, which in many ways took the lead in development assistance. So how did this start?
Well, after Japan emerged as one of the biggest economies in the world, Japan also started to devote a larger share of that wealth to development assistance, particularly in Asia, its neighborhood. The deep roots of ODA from Japan were war reparations from World War II, but Japan then began to export its own economic system regionally. And so most of its early development assistance was really in the form of helping its neighboring countries modernize their economies.
And that focus has changed today, right? What's it doing?
Absolutely. Japan has moved from the very hardware much more into software, into things like education, social development, and more recently into health. They've become a major player in global health, funding many of the international cooperative efforts on health protection around the world, but also a lot of bilateral aid that they're giving is health focused.
And talk a little bit more about what you wrote about in the report, specifically what they're doing in terms of health diplomacy. You mentioned a few of the broad topics. Let's talk about some of the specific things and how are they helping?
Well, as I said, a lot of what they've done is provide funding. But Japan also has a tremendous domestic history of public health improvement. And now the Japanese are beginning to tie those two things together. And it's quite an exciting time because the Japanese obviously are famous for having an excellent general public health, wonderful longevity and great health statistics overall at a low cost. And as we're looking around the world for ways to improve health in developing and middle income countries, there are a lot of lessons that can come out of Japan's own experience there.
And briefly, what are a couple of those really important lessons?
Well, one of them has to do with health systems development. It's not just a matter of providing particular equipment or vaccines or even methodologies, but an entire, almost the bureaucracy of healthcare provision that Japan developed in the 1950s in Japan, where they could dispatch health workers all over the country and really work with the people at basically the grassroots level. And that's a system that they're now trying to introduce in other countries.
And how is it expanding this effort beyond Asia? And talk a little bit about where you're seeing these systems replicated, if indeed they're being replicated.
Well, it's an uphill battle. I mean, one of the reasons it took them a long time to try and propagate these lessons is that so much of these are cultural. And, the Japanese have a reputation for being quite unique and seeing themselves as unique. And I think they felt that, well, we did it this way, but that doesn't necessarily mean that anybody else can do it this way, particularly in far-flung places like Latin America or Africa. But the Japanese have moved into sub-Saharan Africa in a really big way, partly because that's where so many of the global health needs are, but partly because they're optimistic about, with Africa on a growth trajectory and emerging middle classes, that some of these techniques that the Japanese themselves developed can be really transplanted and take root in other countries. And they're already making headway in places like Tanzania, one of the huge projects, a public-private partnership in Tanzania, where Japanese corporations worked with the Japanese government to introduce insecticide-treated bed nets. And it's a wonderful example of synergies between the Japanese, the local partners, the government, and the private sector.
All right. Ben Self, thank you so much.
Pleasure.